So today I'm receiving Nicolas Hulscher from the McCulloch Foundation, lead author on the papers titled Autopsy Findings in Case of Fatal COVID-19 Vaccine-Induced Myocarditis, a systematic review of autopsy findings in death after COVID-19 vaccination, and clinical approach to post-acute sequelae after COVID-19 injection and vaccination. Also co-authored the study Determinants of COVID-19 Vaccine-Induced Myocarditis. So, Mr. Hulscher was born and raised in Michigan. He graduated from Oakland University, where he graduated with a Bachelor of Science in Pre-Health Professional Studies from the Honors College in December 2020. He continues his education of Michigan School of Public Health, where he earned a Master of Public Health, MPH, degree with a specialization in epidemiology in April 2024. And he has contributed to the publication of 16 scientific studies, scientifically advancing our understanding of COVID-19 vaccine injury syndromes, their potential treatments, and also origin of H5N1 bird flu, grippe aviaire. Alors, welcome, Mr. Nicolas Hulscher.
Thanks for having me.
Thank you. It's a pleasure for me to receive you and for my subscribers and followers. So you made many work in a short time, many big studies you published already.
Yes. It's been now 16 scientific studies since 2023. But at the McCulloch Foundation, we've actually published over 20 scientific studies since 2023, all exposing the harms and potential treatments for COVID-19 vaccine injury syndromes.
This is interesting. Just let me ask you a question. Why did you have the idea to do studies about particularly these vaccine injuries? Because there was a few of them, not much, but suddenly, yes, we're seeing a surge of many problems all around us. Was there a special event that triggered your research for that?
Yeah, well, Dr. McCulloch has, as a clinician, has seen more myocarditis cases he's seen in his entire career just in the past few years. And, we've seen all the adverse event reporting systems. We've seen studies pile up. We've seen all these anecdotal reports back in 2020, late 2020, 2021, that, we kind of understood that something was wrong. The mechanism of action of these mRNA injections was obviously novel and experimental. And, we knew that the body producing a non-human toxic protein, the spike protein, would result in a large number of adverse events and death. And so that's why we began our investigation intensively to explore exactly what syndromes does it cause. Does it cause death? That was one of our studies where we collected autopsies. And so basically, yeah, we just kind of understood that this was a dangerous product. And, there's not many studies, there's not many researchers or research centers across the globe that were really looking into the real harms of these shots. So we definitely wanted to contribute. But regarding injury syndromes and their treatments, really nobody has been studying their treatments. I mean, there's literally, like, I can only count a handful basically on my hands, maybe 10, 20, 30 studies for treatments for the vaccine injured. So that's another big part.
Yes, and many people are asking us, and even in Canada, Quebec, everywhere, is there treatments for that? So sometimes we can say maybe yes, maybe no, but effectively there's none, a strong study against it. But more than that, I don't see the authorities want these treatments. Is it? Am I dreaming it, or is there a blockage from the pharmaceutical business or whatever? They don't want these treatments to go public.
Yeah, there's a major blockade. Not only is it Pfizer, Moderna, and all these vaccine companies and pharmaceutical companies that don't want their adverse events of their products to be revealed. So if they don't even want their adverse events to be revealed, they for sure don't want the treatments to those adverse events to be revealed. They just want to keep rolling out their products and claiming they're completely safe and that there's no need for treatment. So they're a major problem, but also our regulatory agencies have not funded vaccine injury research, have not issued any directives to initiate large-scale investigations into vaccine injury. So it's really what we call the biopharmaceutical complexes. So which is not only pharmaceutical companies, but the regulatory agencies, governments, and even military contractors.
Yeah, talking about military, we know now the origin of COVID was from Wuhan P4 laboratory. This is a military, but also I saw the publication and the talk you had about, the H5N1 avian flu, and suddenly there was a fear about that, and also, oh surprise, it seemed to be has been somewhat engineered. Again, this is a possibility. Is this a fact now, or is still in study?
It's still in study, but we have in a peer-reviewed paper uncovered a very plausible hypothesis that does indicate that the 2021 bird flu outbreak was a result of gain-of-function serial passage research at the USDA Southeast Poultry Research Laboratory in Athens, Georgia. We do have strong evidence. We did find multiple anomalies near this Athens, Georgia site, including the detection of a brand new strain called genotype B1 and B12. These were detected within a few hundred miles of this lab, and then from that detection, that strain actually started to infect multiple animal species. Now it's up to 50 or actually over 100 animal species that this strain has ended up evolving and infecting. And we do strongly believe it is due to serial passage gain of function, which is, and on their USDA website, they reveal that they were doing this where they take H5N1 and put it into, they use mallard ducks, into mallard ducks over and over and over and over again until it mutates, becomes more transmissible or more adaptable to other mammals. And so thankfully, though, it appears to it did expand its host range, but it did not make it more deadly. In fact, it appears it made it much less deadly. And now, even in the past week, our government in the United States has declared an end to the bird flu emergency.
Oh, this is interesting because here in Canada, the news are not there. I just talked about it a few minutes ago before you arrived. Let me show you that. Maybe you saw it or not. COVID-19 vaccines. Yes, the date, July 8th, 2025. Yes, Canada just bought again lots of COVID-19 vaccines in Canada and from Pfizer and also Moderna. And this is their justification. None. No justification. The reason for this contract? None. Or any reason. What can you tell for all the people in Canada listening to us, but also maybe in France, in Quebec, in Germany, Europe, to continue to do this madness?
I can't think of any reason to continue mass vaccinating with genetic technologies, with mRNA injections. I really can't think of one plausible reason, particularly since they have been linked to mass death on the levels of multiple global wars. They've now actually been linked to 17 million deaths worldwide. That's according to a study by Rancourt and colleagues. And the serious adverse events are at such a high level that such a large proportion of the global population was injured by these shots. We are in the multi-millions levels of injury here, and there's just no reason to continue deploying this extraordinarily dangerous technology. The only reason I can think of is they don't want to backtrack. Once they mandated it on their populations, rolled it out, they don't want to come back now and say, well, actually, sorry, what we mandated was deadly, carcinogenic, cardiotoxic, and neurotoxic. They're not going to tell us that. That's why it's up to the citizens and independent researchers to find the truth.
Yeah, so there will be maybe a responsibility liability for that, even though most of the government signed the agreement. In fact, they removed the liability of the big pharmas, but the states still have this liability. Uh, do you have interesting contact with RFK, Robert F. Kennedy, because he want to reform the health system? Is it easy in a good way? Because we were kind of surprised again last week. So he told the vaccine should not go to the little children, but then suddenly I think he approved the vaccination of 6 years old and more.
Yeah, yep. RFK back in May issued a directive to limit the recommendations for healthy pregnant women and healthy children. And unfortunately, last week, the FDA actually fully approved these mRNA shots for babies as young as 6 month olds to 11-year-olds with at least one comorbidity. So these kids are already vulnerable, and this is a large portion of our babies that, because when they claim comorbidity, it can be anything. It can be they're born with diabetes, they're born with obesity, they're born with a deformity, they don't exercise enough. That's really labeled as one of the predisposed factors for getting these shots. And so there's so many reasons that they'll still now continue to push them. But full approval is so dangerous because it kind of solidifies the mRNA technology, the mRNA platform into our system, into our public health system. And this is the complete opposite of what we wanted to see. And clearly, they are going against RFK's directive, but RFK has not spoken out strong enough against this. It's time for him to speak out.
Mm, I agree. And you and the McCulloch Foundation, you made publication like approved like an IH. So this is an authority, a risk stratification for future cardiac arrest after COVID-19 vaccination, 26 February 2025. So just this study should be enough to stop all. No.
Yes, this is actually the first peer-reviewed study to fully elucidate the syndrome known as COVID-19 vaccine-induced cardiac arrest. It's not acknowledged by any regulatory agency worldwide. They claim it's impossible, but we lay out not only the population level data, but also the biological mechanisms behind that. And so we actually have a separate study out, not that study. It's called Excess Cardiopulmonary Arrest and Mortality After COVID Vaccination in King County, Washington. And in that study, we did find a 1,200% increase in excess cardiac arrest deaths right after the vaccines rolled out in the state of Washington, where Seattle is located. And this was using government database, government EMS report data. So it's very credible. So we know that since the injections rolled out, cardiac arrest deaths skyrocketed, right? And then in this study you just highlighted there, we highlight how that happens. And how it happens is the mRNA does reach the heart. That is found in a study by Crossan and colleagues. They looked in deceased individuals. They found the mRNA directly in the heart at autopsy. But also, Bowmeyer and colleagues found the spike protein directly in the heart of myocarditis patients. So we know the vaccine gets to the heart, and once it's there, it does churn out spike protein. It does instruct your cardiomyocytes, your heart cells, to produce this toxic non-human protein. Thus, your body attacks it, and you get this inflammation, right? You get myocarditis, and then this results in micro scars that are not detectable with imaging, as well as larger scars that can be detected. And then you get these electrical conduction abnormalities and these lethal arrhythmias, resulting in sudden cardiac death. And unfortunately, that's what happens. And that's why we've seen large numbers of athletes dying while they're exerting. And because we also highlighted in that study the two key triggers for this cardiac arrest are during sports or exercise, or during the waking morning hours of sleep, when there is a surge in what's called catecholamines, including dopamine, norepinephrine, and epinephrine.
Oh, this is the first time someone talked about it. I'm glad you talked about the athletes, but because we were wondering what caused this for the athletes. Because yes, the heart is at the center of their performances, and maybe the pump is going stronger and stronger, but also pushing the poison everywhere in the body. But mass myocarditis or cardiac arrest, people told us already there were cases like that before. It was not the first time, but when we see the data, like the one you shown in your reports, and also the VARS, we're talking about 67% of more death from this vaccine than all the vaccine combined. And again, do you have some people from the professional athletes who listen to you, who want information from you?
You know, most professional athletes, most movie stars that took these shots, they don't want to talk about it. They don't speak out. And it appears, you know, they might be seeking this information in private. There are some, you know, that have contacted, you know, Dr. McCullough Foundation, but it's not many whatsoever. Most of them, they told all their fans to go get the shots. And again, when people tell people to get something that turns out to be a disaster, it's very hard to backtrack psychologically. And that's something we do need to see, though. We do need to see these star players, people, that people look up to, that people really idolize. Some of these stars, they have to start speaking out.
Yeah, we will try to push them to speak more because we need them, and also, of course, the media, the role of the media. A few questions already. Have you studied the reactions of the blood with vaccinated people specifically?
The McCullough Foundation, we actually have a study coming out within the next few months or so. We're putting the finishing touches on it. We actually did detect in somebody's blood um, spike protein, vaccine DNA. So these DNA plasmids from the manufacturing process that were embedded in this individual actually 3 years after vaccination. And so we are currently looking. We have a few other studies we're working on. We are analyzing the blood of vaccinated individuals to see if any changes have occurred, and the data is not looking good. It does appear that vaccine components are still detectable, circulating in some vaccinated individuals. And then there's other studies that have been previously conducted where they do find circulating spike protein in the blood of individuals years after vaccination as well. And we do know that the spike protein does induce blood clotting, causes all sorts of clotting syndromes and strokes, a vaccine-induced immune thrombotic thrombocytopenia. That's well established. So these vaccines are disastrous for the human blood.
Yeah, so it's poisoning them everywhere because if it's in the blood, it's going on many internal organs. Like I said before, I lost a few friends. A question about, well, maybe this is this kind of answer. It's in French, but do you believe these mRNA treatments can cause cancers or rapid virulent cancers to some people?
Yes, of course. Yes, of course. We have an article out actually on our Substack. Somebody has actually collected 100 studies looking at the carcinogenic potential of these shots. And based on these 100 studies, there's 17 different mechanisms that these mRNA shots may actually induce cancer. And so we know biologically can do that, but population wise, there's somebody called Ethical Skeptic. He's a very seasoned data analysis. He used the CDC data here in the United States. He actually found 100,000 excess cancer deaths since the vaccines rolled out in 2021. And so, and that the level of excess cancer deaths is actually still accelerating. So we do believe these shots are indeed carcinogenic. There's 20, 30 case reports in the peer-reviewed literature where people get these shots, and then all of a sudden They get massive exacerbations of their current cancer. So all of a sudden they start to grow and spread uncontrollably. But we also see very rare cancers soon after mRNA shots, including cardiac tumors. Cardiac tumors, I mean, that's such a rare tumor. And then all of a sudden we get these
Yeah.
case reports.
Well, can you explain what is it? It's the first time I hear that.
Yeah, it's literally tumors that are growing on the heart, right? So it appears that this vaccine mRNA spike, it's getting in the heart and it's causing it's literally so there's three things that can happen, or more than three things, but the main things that can happen is the spike protein actually suppresses tumor suppressor genes, right? So your body's not going to be able to prevent these cancers as much, and it induces IgG4 class switching, a form of immune dysregulation. And when your immune system's all out of whack and you have a carcinogenic protein, in your heart, you can start to get metastasis, you can start to get cancerous growths. And so it's not surprising that we see these tumors in various forms of the body and in various spots that are previously undetected.
Wow. Incredible. I asked you a question yesterday. You answered me with a study about neuropathy. So I have a question yesterday about neuropathy. Yes, you sent me this one, and also not just neuropathy, but I ask you about the mood problems. We saw many people having suddenly mood problems, and yes, there seemed to be a study. There's a study right now, a recent one, between COVID vaccination and neuropsychiatric conditions. This is kind of new. This is a new study again. This is important, this one.
This study is extraordinarily important. But regarding neuropathies and really anything neurological regarding the nerves and the brain, the spinal cord, these mRNA shots decimate the neurological system. But let's start with, before we go into that study, a study by Ota and colleagues out of Japan found the mRNA and spike protein in the brains of stroke patients 17 months after their last injection. So we know it reaches the brain. We know the shots increase the risk of what's called transverse myelitis or spinal cord inflammation, which can result in paralysis. So we know it causes all sorts of damage there. But this study now, these mRNA shots have actually been linked to 86 neuropsychiatric conditions, including psychosis, homicidal behaviors, schizophrenia, Alzheimer's, dementia, cognitive impairment, basically everything under the sun. And how they found that was they actually looked and they compared in the VAERS system, Vaccine Adverse Events Reporting System, they compared the flu vaccinations, what was reported there, with the COVID vaccinations. And if it occurs 2 times more than the flu vaccinations, there's a safety signal. So for 86 of these, it occurred up to 3,000 times more with the COVID shots. So there's so many safety signals with these neuropsychiatric adverse events. So not only is it damaging the brain, but it is resulting in abnormal behaviors and in these mental illnesses.
Yes, like my mother had since AstraZeneca. She's lost her brain. Is like they call it kind of brain fog. We have a high surge of dementia suddenly, like Alzheimer everywhere, like an epidemic of Alzheimer, although it's not epidemic by nature. So there's a link with the brain, unfortunately. And another question, I have so many questions, but do our doctors in Canada, in Quebec, or France, in Europe, do they know about your research? Because when it's published, it's available for all the planet. Do you have some calls from doctors from here or whatever, or it's just cut?
Yeah, we have calls and emails from doctors all across the world that are concerned about these adverse events. And, at least here in America, we know that 85% of healthcare workers don't take these shots anymore. So we do believe that, a lot of healthcare providers, probably in Canada as well, they do read this research. They do understand the risks, but they're just afraid to speak out publicly for fear of losing their jobs.
Wow. And again, it's interesting what you just said about 85% of healthcare workers didn't take the shot. This is the
Correct.
kind of statistic you have. Wow. Because
Correct.
in Quebec, in Canada, they said, oh, almost everyone must have the shot. And unless in Quebec it was harsh, maybe than other places like California, like if you don't take the shot, you were fired or you were out. It was incredible. But I'm not surprised from what you're saying. And yes, they're afraid to talk, they're afraid to lose. I know personally a woman, a neurosurgical one, and she can't talk, and she can't even talk about it on the room, on the table in the morning at the hospital. It's like a taboo sujet. Do you see this pattern also in the United States?
Yes, yes, people are very much afraid to speak about this, and people are tired of speaking about this, right? People, it's been 4 years, people don't want to talk about mRNA shots anymore. They just want to let it go, forget about it. But we can't. We can't forget about it. Too many people have been harmed and died and are suffering permanent disability, and they keep
Yeah.
approving them. They keep rolling them out. So we can't just sweep it under the rug. We're going to keep fighting this battle till the very end. And I
Yeah.
really urge all the doctors out there to really start to speak up, because people's lives are more important than keeping, your salary at wherever you're at. Find a job somewhere else then. If you're afraid to speak out, unfortunately, that's the reason why these shots are still on the market and causing mass harm.
Wow. Yes, strong message. Another question: did the big pharmaceutical try to block you or to slow down your researchers, or yours or those of Dr. McCulloch?
Yes. Oh, I
Oh
can't
yeah.
count how many times. I can't count how many times. I mean, we have published, I'll give the prime example. Our study, a systematic review of autopsy findings and deaths after COVID vaccination, where we found a causal link between COVID vaccines and death with 325 autopsies. We actually found 73.9% of these deaths were due to the vaccine. And it was deaths via multiple organ systems, majority cardiovascular, followed by neurological, hematological, immunological. And we published that in Forensic Science International, one of the leading forensic science journals. And it was there for about 3 weeks until they unethically retracted it.
Ah,
Yeah, they approved the study, right? The editors signed off on it. The peer reviewers signed off on it. They thought it was a great study. And then they must have got a call from somebody in the pharmaceutical industry, somebody in the government that told them, listen, you got to pull this. Because what's key about this study is it actually became the #1 trending research paper in the entire world across all subject categories, according to the International Observatory of Research. And so, because it was getting so much attention, this is unfortunately what they do. They give them a call, they contact them, and they tell them, pull the study. And we have encountered these unethical retractions multiple times. Many other researchers have as well that have spoken against the narrative. And this is also partly what we call the journal cartel or the academic publishing cartel. It's this conglomerate of major publishers that doesn't let anything get published that's against their narrative. So it's a big syndicate, and we're not in it. If we speak out against their narrative, we face attack. So yes, we have faced major backlash in our pursuit to publish these studies.
yeah, thank you for your courage to continue because it's a big fight. Yes, in France there was the Lancet scandal. Maybe you heard about it. Also, this kind of publication they cut studies. Hugo has a question, and this question is it seemed to be so impossible a few years ago, but now and there's many people talking about it. Is it possible that we will reach 100 million deaths before 2030? Because some people talked about it, and many people told, "Oh, it's exaggerating, it's impossible." But we see the trend right now; it's not good.
It's possible. It's possible. By 2030, we could definitely very well reach 100 million deaths as a either result or side effect of these shots. But concerningly, and what I think would actually be a larger contributor to loss in population size would be the mRNA shots decimation of fertility. because we now know that it does destroy over 60% of women's primordial follicles, this
Wow.
non-renewable egg supply.
60%.
Yeah, but that was an animal study, but a human study just came out by Manichi and colleagues that found 33% lower successful pregnancies or successful or 33%
Yeah,
lower successful conception rates
exactly.
in vaccinated women with a sample size of 1.3 million women.
Yeah.
So as this happens, as women's fertility is destroyed and men's fertility becomes destroyed, population size will tank, birth rates will tank. 2025 birth rates are in, and they are extremely low, extremely low. And this, so not only will we have the inability to regenerate the lost population, but we also have people dying as a result of the shots themselves.
Yeah, it's from both way. And yesterday I just talked about it. In Quebec, it's a mess. In the birth rate is plumbing. We have a birth rate. The next time we had this, it was in 2005. But since then, our population growth, so we were supposed to always grow, but now we're at this level, and the death rate is more than the birth rate. So this is a catastrophic. Um, and you passed a few years ago. You were in the university in the medicine environment. What were they talking about? Was it a believing that the medicine can do no wrong, they can do mistakes? What kind of mentality is it? Is it only for the money, or some people are deceived, or what do you sense from your colleagues? Maybe you met at the school and university. What they're thinking about that right now?
Yeah, most universities, including my former school, University of Michigan, subscribe to what's called vaccine ideology. It has now become a religion where people relentlessly worship vaccines as the only solution, and there can't be any side effects. So that's what I unfortunately saw there. I actually presented the autopsy paper, the systematic review paper, at the poster session there, and I was met with all sorts of shocked looks, professors that didn't even speak to me, my own professors. I was actually
Oh,
warned at the university that I would never have a career if I continued to pursue the COVID
oh,
vaccine harms. Yeah, and we actually had a class, an epidemiology class for infectious diseases, and one of the slides said spike protein is good for you.
eh,
Spike protein is good for you, and I'll never forget that. So it's just shocking what they're teaching the students now, and so it is a form of brainwashing, and it's not. So they're not doing this intentionally for money. They're simply lost in the religion of vaccine ideology.
but again, even if a teacher show that to the people, we're not students enough have the intelligence just to ask question. Hey, are you sure of that? How can you explain that? So there was no reaction. People just accepted it.
Yes, all the students just accepted it.
Oh,
Now, myself, I was looking at it and I was just shocked in my head. Like, how is a spike protein that's been linked in 1,000 studies to, serious harms to every organ system good for you? It's just, it made no sense. There was no citation in the slide. It just claimed it. And yeah, everybody just took it and believed it. And so that's the sad part about our universities, about our training, our public health training programs here in America. It's all compromised, and it all doesn't look at any adverse effects of these vaccines. It's just not talked about, and that's something that really needs to change.
yeah, no, mindset to change. Yeah. Do you think there were any intentional fake vaccine? Because there was also that the nurse in Italy in Italy that went out and said there were 4 doses, and of course at this time everyone uh, was on her back to say this is fake news, this doesn't exist. Is it a plausible thing that all the lots are not equal?
Oh, yes, for sure. For sure. There's now 4 studies that show lot variability, significant lot variability. We're actually, the early 2021 batches were actually the most dangerous, it appeared. And yes, some lots are linked to large numbers of adverse events. Some lots are linked to no adverse events really at all. and they're basically batches called duds, right? Probably the mRNA is degraded, or it's been left out of the refrigerator for too long, or the manufacturing process was a bust and it wasn't manufactured properly, thankfully, right, for those
Yeah.
individuals. But yeah, some of these batches, they just decimated people, and they're probably contaminated with high levels of DNA plasmids from the manufacturing processes, maybe
Yeah.
extremely high levels of mRNA, even heavy metal contamination has been detected in these batches. So all sorts of things. But yeah, really no batch appeared to be the same.
Yeah, yeah, we saw that with the lots of my wife took one and we checked her lot and it was different from other lots. We saw the numbers very different according to the numbers. This is a special, yeah. So of course she's worried about it, but because our finger. Uh, and again, you continue your work. The foundation is very active, the McCulloch Foundation. You published just yesterday the study about the stomach, the COVID be hiding in the GI tract, so in the stomach, and that could explain maybe the kind of epidemic last year. Many people, and most vaccinated, we call it the vaccinated, the gastro pandemic vaccination problem. So you published that yesterday. Will it be other study about it or whatever? What can you say about that? That if you found this virus place there, what could be the impact?
Now, this is not our study. This is Doctor. His name is Doctor Zabello. He's actually has found he has found all sorts of issues in the gastrointestinal tract,
Mhm.
especially with the species called Bifidobacterium, so the microbiome, in people who are infected and in people who are vaccinated. It appears that both of these do decimate the microbiome, and
Mm.
this is evidenced. Actually, we saw a recent study out. They didn't look at anything regarding infection or vaccination, but this recent study found 25% of U.S. infants have no bifidobacterium at
Oh,
all. So it is being decimated among the population. This keystone strain is being erased. Somebody who's key in this work, her name is Dr. Sabine Hassan. She has actually been the one that has found that the mRNA shots do deplete bifidobacterium levels. But it's not just microbiome. The virus and the shots do appear to exert a lot of adverse effects on the gastrointestinal system. So it's not just the microbiome, but yeah, it
mm.
appears that this spike protein is bad for literally every single organ system,
Yeah.
including the gut.
Yeah, this is important. And 2 years ago, we had a national citizen inquiry in Canada. And I remember I covered it. And one of the specialists about this part talked about us. They found very rapidly that there was a collapse of the microbiotes and all that. So this was important. Uh, just a few questions. I know your time is precious. Thank you very much again to answer all these questions. People have so many questions. Any treatments available? So is it possible to reverse all a part or what's the
Yes,
solution?
yes. So I'll go over a few key things that has been studied for vaccine injury. The main one and the easiest one to do is to get sunlight or at least raise your vitamin D level to adequate amounts. There's two studies. One of them showed that when you increase vitamin D levels to adequate levels, your risk of death, hospitalization, and severity from vaccine induced myocarditis significantly decreases. So you want those levels up. But another study found that adequate vitamin D levels actually decreases severity of vaccine induced chronic fatigue syndrome. So it improves that as well. But we also, and Dr. McCullough has developed a protocol, and we actually published a paper on this called, it's actually called McCullough Protocol Based Spike Detoxification. And this is three key enzymes, three safe natural enzymes. One is bromelain from pineapples, one's curcumin from turmeric, and one is from natto. It's called nattokinase. These three compounds have shown, at least in the test tube, to degrade spike protein, and in various case reports that are now published, shown to bust open and break free these spike-induced clotting syndromes, improve the blood flow there, and really kind of help the body clear out the spike protein. And so that's one of the treatments now we will be conducting further research on as well. We do need clinical trials on that, but these anecdotal reports, these case reports are showing promise so far. And obviously, key things like other nutrients, right? Other minerals are key and critical. If you're sitting there eating hyper-processed foods, you're going to be at a higher risk of death, really from anything, regardless. So you got to improve your lifestyle. You don't want to be obese. If you're obese, you got to reduce that BMI to a reasonable level. So there's so many things that can go into it, but those are the main things, and we will continue looking for solutions.
Thank you very much. This is important. And another question many people have: is there blood transfuse are a problem or a potential problem? Again, there's no study about it. I think, unless I'm not aware of one, but the transfusion. And also the other question: can unvaxxed people can cut the vaccine effect? These are some questions that are recurrent.
Well, if the blood from somebody who was recently vaccinated, or at least has some of these vaccine components in their blood, then yes, if you do receive the transfusion, you'll be receiving those vaccine components. Now, a vast majority of the population is not taking these shots anymore, and so they're really, it's not like if you go get if you go get a blood transfusion, you're automatically gonna be infected with vaccine components, right? It's actually, it appears to be a low risk at this point in time, as most people are refusing them. But really, the best way and the only way to tell would actually be to conduct a large scale study and look at in the blood of a representative sample of individuals to see if these vaccine components are still residing in individuals, and that would really give us a clear answer. But right now, it appears that the risk should be quite low, but the risk is there.
Okay. Yeah. No, it's a special time to live. Let's say that. Political question, the last one. What do you think of Trump's silence on these products and the excess mortality of Americans? Again, I remember I talked to Joseph Ladapo, and he was against it. He launched a study for all the people who were dying. Also, maybe you will have his data, the data of Florida, or you will have it, or you have it. But the political world, I think, even Trump's administration, they don't talk much about it.
No, they don't talk about the excess mortality really at all. Really at all. And I know Joseph Ladapo, Florida Surgeon General, is a senior author on a recent preprint that came out where they looked at Moderna versus Pfizer recipients. And actually, Pfizer recipients had, about 25 to 30% higher risk of all-cause mortality compared to Moderna recipients. So just that alone shows that automatically Pfizer killed, based on an extrapolation to U.S. estimates, Pfizer likely resulted in around minimum 480,000 American deaths. And you can probably extrapolate that to Canada as well. Again, Pfizer alone at minimum is linked to a few 100,000 deaths in the first year alone based on that study. And yeah, we are likely in the millions at this point.
Yeah, so that will be a topic to talk for many years again. Thank you very much for your time. It's appreciated. I will. I hope I can meet you live, also in some event someday. This is important, and we'll have many work to do again to talk about it, to teach the people what's happening. And I understand that many people right now, and I have many testimonies about it, don't want to talk about it because they were trapped in that, and their mind is trapped too. They can't admit they were they were lied to. And last word for you.
Yes,
Important.
people were lied to, people's feelings were hurt, people have a very hard time accepting the choice that they may have made for their own body or for their family's bodies, their family's health. And we just gotta accept the reality of what's happened, and we got to look for treatments. We got to look at ways now to reverse this damage. We're going to keep exposing here at the McCullough Foundation. We're going to keep exposing these new harms. We're going to keep finding out what it's done to people, but we're also going to be finding solutions as our governments completely refuse to do so. And we're not going to stop. We're not going to stop until we have real solutions and until these shots are completely off the market and hopefully banned for human use as the death toll continues to mount.
Thank you very much, and have a wonderful day. We'll talk again, I'm sure, about it. And thank you for all your studies you're working. It's a hard work you're doing, but very important one to show to all the earth what's going on. Thank you.
Thanks for having me.